Hello, Sam. How do you feel about people using in vitro fertilization to bring babies into families that have been having trouble conceiving children?
Wait, what is in vitro fertilization?
Well, according to Edward Kaplan, Avner Hershelig, Alan Deckerney and Gadi Levy in their journal article, "Should Be or Not Should Be, That Is Conception. Managing in vitro fertilization programs," found on page 1217 in the Management Science journal. In vitro fertilization is a sophisticated process that retrieves eggs from a patient, fertilizes the eggs in a lab, and transfers the embryos back into the uterus. However, as the authors continue to state, there is less than 12% chance the patients will become pregnant.
Well, that seems like a low percentage of success. Why do not all couples use in vitro fertilization if they are having trouble conceiving?
There are many different economic struggles that plague couples that turn to in vitro fertilization as the last resort. As the scholarly article, "A Live Baby or Your Money Back: The Marketing of In Vitro Fertilization Procedures," written by David Schmidtlein and Donald Morrison on page 1613 in the journal Management Science, couples that seek in vitro fertilization typically are marketed two different options. The first option is a $7,500 option each time a couple tries in vitro, regardless of the outcome. Or, couples can choose a $15,000 $3 attempt, and if there is no live birth, then the couple will be refunded.
Even though that seems like a lot of money, in vitro fertilization typically the last resort for couples, or the only option that same-sex couples or single people have.
Exactly. As David Schmidtlein and Donald Morrison state, since insurance typically does not cover in vitro fertilization, couples get to choose their own assisted reproductive technology, or our clinic. Therefore, couples will pay about $7,000 to $10,000 per treatment. The chance for this success for a healthy birth is 20 to 25%.
Even though this is the last resort for some couples, it may also become economically straining and stressful if there is no healthy child that is the investment of thousands of dollars. And found later on page 1616 of the article, the money-back clinics typically have less of a successful live birth rate.
From the Medical Care Journal, the scholarly article, "The Willingness to Pay for In Vitro Fertilization, a Pilot Study Using Contingent Valuation," written by Peter Newman and Magnus Johannesson, "There should be no price put on the importance of starting a family. Without in vitro fertilization, infertile couples, same-sex couples and single people wishing to have families would not be able to start families."
I agree. However, it is hard to ignore the fact that all of these couples are investing so much money and might not have live birth. Also, as Peter Newman and Magnus Johannesson state, there is a higher risk for birth defects and multiple births from in vitro fertilization.
Yes, it is a very high price to pay, but in vitro fertilization has brought happiness and the start to families that have never had the option before. As Andrea Bonnickson states on page 148 in the scholarly article "In Vitro Fertilization, a Women's Political Issue" from the International Political Science Review. 1 in 6 married American couples are infertile, and about 40% of the infertility is traced back to the female. Therefore, the new technological procedures helps all different kinds of people to have a child, even though it's a large price to pay.
That is remarkable. Thankfully, reproductive technology helps these infertile, single women and homosexual couples start families, even though it is a large financial investment.